So guys, Animal Hospital has a lot of anomalies. Some of them are hidden, while others are easy to spot. In this video, I've included every anomaly based on how they appear. So, let's start with the ones that are easier to detect. The patient will have 3 glowing red eyes. This is one of the easiest anomalies to identify. The patient appears with black, hollowed-out eyes and a frowning mouth. Sometimes, this anomaly can only be seen through the security camera, so make sure to double-check the CCTV feed. The patient will have realistic-looking human eyes and a mouth. It might not sound scary at first, but compared to the normal animal patients, it's extremely unsettling. The patient will twitch uncontrollably. Their arms and head may jerk around, and sometimes their neck will unnaturally stretch and elongate. While this anomaly can occasionally be seen normally, there are times when you'll only notice it through the CCTV camera. The patient's or visitor's photo will look slightly different from how they appear at the check-in window. Usually, you'll notice changes in the eyes or ears, and sometimes horns may be added or removed in the photo. The patient may appear completely normal in person, but their photo will show eerie, realistic facial features. The patient's photo will have a grainy, static effect, making it look distorted. The patient's photo will have wide, bloodshot eyes and an unnatural grin. If you pick up the photo and look at it, you'll instantly lose 10 sanity points. The patient or visitor's face will be covered by a black image featuring a pair of eyes staring directly at you. The patient or visitor will appear heavily stretched and distorted through the CCTV feed. Instead of behaving normally, the patient will stare directly into the security camera. Honestly, it's one of the most uncomfortable anomalies to witness. The patient's entire body, including their eyes, will appear completely black, almost like a living shadow. This anomaly appears when you inspect a broken camera through CCTV. The camera will slowly zoom in on a dark figure with crooked teeth and glowing red eyes. If you don't exit the camera quickly enough, the figure will jump scare you and deal potentially fatal damage. Getting caught by it will cause you to lose 20 sanity points. The patient's ears will look different through the CCTV compared to how they appear at the check-in window. So, those are all the anomalies you can identify during the security process. Now, let's talk about the hostile anomalies you'll encounter while treating patients. The bed monster appears as a black figure with round red eyes and shadowy hands. It hides underneath patient beds, surrounded by a transparent red box. Stepping inside the box causes the monster to grab you and drain your sanity. To get rid of it, approach the red box while holding maple syrup. The monster will take the syrup and leave peacefully. Interestingly, the bed monster can also attack patients and wall anomalies. The stalker appears as an extremely tall black bunny with an unsettling toothy smile. Looking directly at it causes you to lose 10 sanity points. This creature can appear anywhere around the hospital, often peeking around corners. To survive, avoid making direct eye contact whenever you pass by it. This anomaly appears as a horrifying mass of eyeballs and flesh attached to the ceiling of patient rooms or the CCTV room. As the name suggests, don't look up. If you do, the mass will begin glowing and rapidly drain your sanity. Sometimes, the best strategy is simply not knowing what's above you. Wall anomalies can appear throughout the hospital, usually in groups of 2 to 5. If you walk directly toward them, they'll begin chasing you. They deal sanity damage and can even steal items from your inventory. If you encounter them, immediately run in the opposite direction. They'll fade away into black mist. Skinwalkers can appear in several different forms. but they're usually identified by their sharp teeth and wide-open mouths. These anomalies are created when you accidentally allow infected patients through check-in. Skinwalkers actively attack both players and patients. If one attacks a patient, sneak up behind it and attack. If it grabs you, press E repeatedly to strike its pressure points until it lets go. Ignoring them will result in rapid sanity loss. Headbanger appears at the check-in window. It looks like a patient with hollow eyes repeatedly smashing its head against the glass. To neutralize it, give it coffee. Trying to stop it without coffee will cause you to lose a massive amount of sanity. If ignored for too long, it will crack the window with one final slam before eventually walking away. This anomaly appears unexpectedly in room 8. A huge mass of purple tentacles erupts around the patient, and you'll have only 45 seconds to perform surgery. If you fail to complete the procedure before time runs out, the patient will die. Also, never use a taser or gun on this anomaly. Doing so will instantly kill the patient you're trying to save.